Hello, everyone. Thank you so much for joining us tonight. We are just so excited that you're here with us. Just know that someone really cares about you to have invited you to this call tonight, and wants you to know about this technology. The call tonight will be for 30 minutes. And if we have new people on the call tonight, we're going to be talking about the X39 patch that activates this amazing peptide in our bodies. We want to get started with our medical disclaimer. Tonight, what we will be sharing is for informational purposes only. If you have any medical conditions, please check with your physician or healthcare practitioner. All LifeWave products are not intended to treat, cure, diagnose, or prevent any disease. If you're on medications or have a medical condition or are pregnant or nursing, please check with your physician first. I am so excited again tonight about this amazing call with my wonderful friend, Judy. She actually did an initial testimonial call I guess in January. It was in January, maybe. So several months ago. And now she's had some other things go on in her life and in some of her family's life. And so we are going to get to hear more about that. And so I am just going to let you take it away, Judy. Tell us what's been going on with you and your family.
Okay, thanks so much, Nikki. I've been on the patches for 5 months. I have been faithful to use the X39 at the C7 mark and the Eon right below the belly button. I have an autoimmune that's fairly serious, mast cell activation syndrome. And so I've been seeing a lot of help for that. And so when January came along and I went to my annual visit to my optometrist for the 4th year in a row, he said, "When are you going to take care of your cataracts?" And up till that point, honestly, I just didn't care. I didn't have a lot of symptoms. So I said, "I think this is the year I'm going to do it." He said, "Okay, here's the surgeon, go for it." So I set up an appointment. I did it for March 26th. Yeah. So it's been 2 weeks. And I was privileged to get some of the information ahead of time, like we get on our, patchology stuff about how to apply the patches for healing prior, during, and after surgery. So what I did is I placed X39 right on my temples and above where my forehead is. So 3 of them prior to it, during, and after. And I did it knowing that the healing was necessary for the X39. So I did the surgery. I came through with flying colors. And when I went to get the recheck, he said, "Wow, you're healing extraordinarily fast for this particular surgery." He didn't ask what I was doing. He was just really pleased. So I was thrilled. I was really, really happy about it. So I go for another exam for the month. And I know that it's going to be beautiful because I'm seeing really, really well. And I'm waiting for the last part of the healing, which is the upfront reading part. The distance is done, the mid range for intermediate's done, and now the reading is the last to heal in the eye. So I keep putting the patches on and I'm just feeling wonderful about it. So I want to thank God for just extraordinarily results because I did what I was told to do through this information that's been given to me online.
That's awesome. And I think too, just the fact of being able to wear the patches for 4 months in advance of a surgery.
Sure.
Sometimes I talk to a lot of people who are like, well, I'll just wait. I'll just wait and I'll start when I have my surgery. And it's always like, oh, no, no, no.
Yeah.
Can we please talk about why it would be amazing for you to start patching before you have surgery? And so just to get those stem cells up and going and regenerating and doing their job is so key, so that you can get to a place to where you've worn them long enough to where they start to have a compounding effect. And I know we weren't at that place for you yet with the surgery, but always starting beforehand is huge. So I am so glad that that has been so good for you. That is amazing because I know that's one of those surgeries that nobody really wants to go through. They just kind of want to avoid and not have to do that. So it's always so nice when you can, when you have to have a surgery that the results can happen so quickly and so fast. So
Yes,
what an
and they
absolute
say
blessing.
They told us it's the most successful surgery of all surgeries that are out there because it's only 5 minutes, but they're still, it's your eyes. So it's still a little frightening. So it made me feel really good to have the patches ahead of time and then during and then after and still now, so I'm really thrilled with the results that I can actually see after 50
Yes.
years of not being able to see well. So, and then
Yes.
now, if you want, I can share about my grandson. That's testimonial
I
because it's
would
amazing.
love that. Yes, we want to hear about your grandson for sure.
Okay, so around Christmas time, I was starting to get more familiar with X39 and a little bit with IceWave, not too much because I don't have a lot of acute pain or anything. But my grandson was in an accident with his sports with basketball where he was playing on the court and a child came up and elbowed him on the side and knocked him over. That happens with sports. And when he went down, he was injured in such a way that they didn't know what happened to him exactly, but he couldn't get back up well. And he was real crooked in the way he was walking, and they knew he was injured pretty bad. So they took him to the doctor the next day and they diagnosed something with his leg. Well, it turns out it was a misdiagnosis. He actually was hit in the spine, a lower in the back, and he was actually holding all of that pain in such a way that he became a child that looked like somebody who had major scoliosis, and the twist and turn in his spinal column was absolutely out of, like, you couldn't believe what he looked like within just 2 weeks of the injury. And so the pain was excruciating. He went to many doctors. He had a lot of treatments done, and after this is 18 months ago, he's still in pain, chronic pain, 7.5 type pain daily. So I patched him at Christmas time, not realizing that water is essential when you're taking these patches for people who, I think I was told that, but I just didn't retain it. And so it didn't really help him. And I didn't know about the clockwise method. And so they all just kind of said, oh, Gigi's kind of, she's one of those people, just, let her do her thing. And then they just walked away like that didn't work. Well, I knew it would work. I had watched too many of the videos. I knew I wasn't doing something quite right. So at Easter, I tried to do things sooner than that, but it just wasn't well received. So at Easter, he was in quite a bit of pain. And so I said, hey, why don't you sit down? I had just watched a video from 2020 with David Schmidt, and it was patching for the back. And they said if there's really stubborn back pain, to go ahead and do the bottom of the foot. And I didn't know that. So I went ahead and had him do the bottom of the foot with the IceWave, with the tan patch. And then we went in the clockwise. We started at noon, went to 3 o'clock, and didn't even have to go to 6, because within those 2 applications and a bunch of water drinking, he went from a 7.5 to 3 to a 0. And he started crying. 15-year-old is crying because he said, I don't like this. I said, what? And his mom said, you don't like being out of pain? And he said, no, I don't like the fact that I don't understand what's happening to me. It just freaked him out because he's been in pain consistently for months and months and months. So we went ahead and his mom said, order it now, because I've been trying to get them on this for a while, and X39 and everything, on anything. And so we put him on. They just got it this week. Today, I asked him, how are you doing? He said, Gigi, I forgot how to do it again. So I said, okay, let's walk through it today. So today at 5 o'clock, I said, okay, get your water. Let's get your shoes off. And so we put it on there. He was at a 7.5 again. He put it on. He said, okay, it's at a 3. I said, okay, let's keep going. This was for me the miracle of all of it. He said, okay, the pain in the back's gone, but it's not gone where the bone sticks out of my skin. I said, what? He goes, yeah, the part where my back twists like that, I have always pain in my skin where the bone hits there, and it always hurts no matter what. No matter what they give me for my shots or whatever happens, I always have that bone hurt. And I said, okay, let's take another IceWave. We're going to put the tan one right on that, and then I'm going to do the same thing. So we did, and drank some more water, and that pain went away completely by the time we went to 3 o'clock. And he could not believe it, because he has not been out of pain for 18 months.
Oh my goodness.
And
That is just amazing. Yes. Praise
yeah.
the Lord.
Yeah,
Holy cow.
there was no Eon, no X39, none of that yet. So I can't wait to get him on more stuff so that he can really experience long-term pain relief instead of just the intermittent stuff.
Right. So so he's not using any X39 or Eon. He's only using Ice Wave.
That's it. And it was just so that we could get our foot in the door with them to understand this really, really does work, because they're just like, no, you've done all these weird things. You're kind of homeopathic. We don't get that. And sort of, you're weird. So this is one more weird thing to them. So for me, it's like, you've tried all the stuff that you've done, and they've gone to really cool people too, that are like decompressing his spine with a really good chiropractor and stuff, but it's not helping him to be relieved of the pain for any long period of time
Right.
without steroid use.
Right. Absolutely. Yes. I mean, anytime it comes to our kids, I mean, it just makes me so happy and so excited to have kids that can live their life and be out
Mhm.
of pain, especially with an injury like that. Like he's doing something he loves, playing basketball, and now
Mhm.
his life is just completely turned upside down. And so
Mhm.
for you to just take one step in that way of helping him with just the pain, alleviates, or, is that lifting of, okay, maybe I can move beyond where I'm at right now, because 18 months in that kind of pain in a kid's
It's a
life
lot.
is like,
Mhm.
I'm going to be here. Am I going to be here forever? Is this going
Yeah.
to be my life forever?
Mhm.
And for the Patches to be able to work on him like that, what an absolute miracle, because now, hopefully he's going to start getting that lifting of, this doesn't have to be my whole life. And hopefully you'll be able to introduce some of the other patches. So I just want to make sure I understand right. So when he was here at Easter, you were doing the K1 spot on the bottom of the feet. And
Right.
you did white on right, tan on left. Is that what you
I
did?
did I did the tan in the center of the foot, right at the bit below the ball. And then I did right directly above it at 12 o'clock. I did the white,
Oh,
and
so
he
you were
drank.
just on his foot. You weren't on his back yet.
No,
So this
just his
was,
foot.
and you were doing his right foot?
I was doing the right foot because he told me the pain was radiating down his right leg. And that's
Okay.
why because when I was watching David Schmidt, he was talking about that if there is a side to pick, if it should be where there's pain radiating, if possible. I mean, if you don't do the back, they were talking in that video, it was very powerful about stubborn pain. And that's what this one was. And I knew it because we'd already tried it before more than once, actually Christmas and another time after that, and it wasn't touching the pain. So I did know that he was probably dehydrated. And the funny part with him being a child, he actually is very honest. I said, he said, I tried it yesterday and it didn't work, Gigi. And I said, well, did you hydrate? And he goes, no, I didn't drink water all day. But he said, I got a big water jug, and now at school I can take it with me, and I'm drinking at least my half of my weight in ounces a day, so that I can get that, because the first time I did it, it worked, but the second time I did it, it didn't work because I didn't drink water. So now he knows he has to drink water, and he's dehydrated if he doesn't. So when we drank the water today, he had already hydrated all day today, because he said, I didn't put a patch on today, Gigi. I said, why? You can do it now, on your own. And he said, well, I just didn't think it was that bad. It's only 7.5 instead of 10. I said, honey, you don't have to be in pain anymore. You don't
Right.
have to.
Yes.
Yeah. So
Yes.
it
Yeah.
was just really sweet. And he said, well, I do have one more question. I said, okay. He said, if I go to play sports, can I put the patch on? And then if I don't drink water for the whole hour I'm playing that game, is it okay that I don't have water that whole hour? I said, yeah, it's okay.
Oh my
Just drink water
gosh.
afterwards.
Right. And just that right there, that he can think about the
Yeah.
fact that he is going to be able to play basketball again. That does my
Yeah.
heart so good. I'm so
Yeah.
thankful for that.
Because
Yeah,
he's
that's
just been
just,
playing, and stuff. He's suffering because he wants to play so badly. He's actually gone from a star player to a B team because he wants to play so badly. He doesn't even care. He loves it so much. So now he has hope that he can actually be
oh,
more pain free. So thank you so
yes.
much.
Yes, I love that. So awesome. So I just want to go back over it. So you just the pain was radiating down his right leg. And so
Mhm.
you put it on the bottom of his foot, which I'm guessing would be, you said under the ball, which is normally we use that K1 spot. If you
Right.
search that up online, you can see exactly where that is.
Mhm.
But then you, on that right foot, you then use the clock method. So if
Mhm.
this is the bottom of his foot, then you went to 12 o'clock this way, or you
No,
went on
I went up towards his toes.
his toes. Okay, so you went up
Mhm.
towards it for 12, and then you
Mhm.
moved around still on the
Yeah.
bottom of his foot,
Yeah, so
3,
we went
6.
here,
Okay.
yeah, here, then over here, and then down below at the 6, but we didn't need to. We could actually not even move it to 6. We left it at 3, and he was fine within about a minute and a half because we were doing 30-second intervals. At first, I went the 15 seconds, and he just stopped and kind of went, and he said, "Oh, I'm feeling something," and he was shocked. But he was scared of it a little bit because it scared him that he wasn't feeling pain anymore, which I thought was an interesting reaction. So I said, okay, drink another drink of water. And so he did. And then that's when it went down to a 3. And he sat down and he goes, okay, like he was done. I said, no, we're not done yet. We're gonna move the patch. And I had explained this to him ahead of time, so he knew what was going to happen. But when we did it, and then he got up, drank more water, and walked around the whole room. That was the fun part, is getting him up and walking. And then he felt the pain leave his body.
Yeah. Oh my
He was
gosh.
shocked. And he went over to a corner, and nobody knew what he was doing because we were all busy just being all excited and talking amongst ourselves. And he had his head turned, and he was actually crying. He was weeping in the back of in another part of the house where it wasn't where we could still see him, but he was just so taken by the fact that he was out of pain that he couldn't believe it.
Yes,
And then
that's amazing.
it made us all weep because we were like, oh my gosh, this is not just working. He's actually had relief after all these years of, yeah, I mean, months of real severe pain, really bad. And some of the treatments he's gone through has been excruciatingly painful.
Oh my goodness. Yes. What that's just amazing. So, and I just think it's so great because it's just a good reminder as well, because now that we have the X39 and we have the Eon, usually we're using those in combination with the Ice Wave. But that with just even the Ice Wave, that we can get that kind of pain relief for someone is so
Mhm.
great. But then, so if I move us into talking about the X39, the reason that we want to add that X39 patch is because of what it can do for the body. So, basically with the X39, what happens is that the patches, even like the Ice Wave, they're completely non-transdermal. So this is what they look like. And so they're not transferring anything from the patch into your body. Most people are familiar with transdermal patches, meaning that they transfer something from the patch to the body, a vitamin patch, an estrogen patch, a nicotine patch. This actually does not transfer anything into your body. It's completely non-transdermal. Um, how it works is it works with our body's infrared light. So if you watch on the movies, when you see people looking through night vision goggles and they see that heat signature, um, it is actually our body's infrared light that you are seeing. And so this process is called photobiomodulation, and that's just a big word for light making change in the body. You all already know exactly what this process is because every time you go out into the sun and the sun hits your skin, it activates the vitamin D in your body and tells that vitamin D to get up and get working and do what it was designed to do in our bodies. It is so the patch reflects that infrared light that we emit back into the body on a specific frequency to activate a specific peptide. It's a crystal lattice structure that is made up of amino acids, oxygen, water, and sugars, not like what you can go and get in your cabinet. They are stereoisomers at the molecular level. And so that reflects back into your body. Because of this, you can actually wear the patch anywhere on your body that you would like to wear it because infrared light is coming off of all parts of our body. It is 12 hours on to activate and repair and 12 hours off. So the next day you put on a new patch, 12 hours on to activate and repair, 12 hours off. The next day you put on a new patch. The peptide that's getting activated is called GHKCU copper peptide. If you pull up PubMed, which is the medical industry standard for any kind of research that you're going to do, you're going to get a list of all kinds of things that GHKCU does in the body. It activates your own body stem cells, which is why with Judy's grandson, we want to be able to hopefully get him on that on the X39 to have. Normally at 15, you're not going to have any stem cells that are dormant, but anytime you have great injury in the body, there's all kinds of things that happen that normally wouldn't take place. And so we want to make sure that all of his stem cells that are there in his body are up and active. What stem cells do in your body is when we were born, every single cell in our body was once a stem cell. And so they differentiate to become a liver cell, become a brain cell, become a heart cell, to where these stem cells that the GHKCU is activating are pluripotent, meaning that they can go to any area in the body and regenerate anything that needs help, balance, or support. And so that is why, hopefully, with him seeing, being relieved in the pain, we'll be able to get him started on the X39 so that he can have the regeneration and probably because he's so young, he would have that regeneration eventually anyway. Just relieving the pain is such a huge gift. But if we could, I'm always about faster. If I could do anything faster, better, more, tell me what that is, because I want to do it. So I would be wearing the X39 as fast as I possibly could. It also helps to activate your cardiovascular system, everything about your cardiovascular system. So it is why we see people that will have benefit and help with their symptoms with any kind of heart condition or any kind of blood pressure issue, because it helps on every level of the cardiovascular system. Any type of wound healing. So I'm thankful that those bones are not sticking through his body because there would be then wound healing that needed to take place as well. So any type of surgery, any type of cut, scratch, this in particular peptide remodels scar tissue. Collagen. Most people think that collagen is just hair, skin, and nails, but it's actually your bones and it is your muscles. And so we need collagen for every area of our body to function properly. And so again, with these, misalignments that have happened for 18 months, trying to help those bones go back in place, the collagen in your body is going to help do that and help those to go back in the way that they were designed to work together in the body. And then the immune system is the other thing that activates. Obviously, all of us want to feel good and not get sick and have our immune system work properly, because that's what defends us against all kinds of disease and illness. And so that's why this in particular peptide is so amazing in our body, because it does so many things. By the time we are 30, half of our stem cells go dormant. And by the time we're 60, we only have 10% of those stem cells still active. And so it's not that they're not in our bodies, they just go dormant. And so this technology helps to tell those stem cells to get up and get going again. The recommendation is for to wear it for 1 month every decade you are old. So I am 50, so I would need to wear it for 5 months to really see what the product is going to do for me. Because what we're talking about is this is completely natural. Again, there is nothing, this is not a drug, this is not an immediate reaction. This is something that takes time. It's a natural body's process that we are telling, we want you to continue to work. We do not want you to go through the aging process. We want you to reverse age. We're working on age reversal instead of just all those things that come with age, the aches, the pains, the illness, the things that happen to us. We're telling that, nope, we don't want to do that. We want to stay young and healthy. So if we fall off our bike, we're not having to go to the hospital. We're going to be like a kid and just jump right back up and get back on that bike and just keep going. So 1 month for every decade you are old to really give your body a chance to see what it does. And then the other thing that I would say is just bringing in the Eon for him as well, because obviously, anytime you have pain like he's having, there is massive amounts of inflammation. So, anytime there's pain in the body, there's inflammation. The Eon patch is our anti inflammation patch that activates a peptide in your liver that's specific to inflammation. It also just, especially like for him, is the anxiety that is being
Mhm.
created because of the
Oh, yeah.
pain, because of the life situation that is completely altered, doing this thing he loves and having that taken away, and then now having to try to readjust and play in pain. That Eon activates the parasympathetic nervous system that helps that calm, rest, digest, that stress relief that people need, and he is especially in need of not only the inflammation reduction, but to activate that parasympathetic nervous system so that he can just try to, not have all of the things that happen to our body when we're stressed. Stress can create any possible list of things that you could name can be created by stress. And so to have him have that activated as well would be so valuable. And I think just help him, be able to heal and regenerate faster. And I know that's going to be a process, but hopefully you're not too far away from being able
No,
to
and
introduce those.
I forgot to tell you one other thing. I just totally remembered as you were talking. The day after Easter, he was going to be practicing to do a game on Tuesday. So that was Sunday. Monday, I gave him the energy enhancer for the game. And I explained to him how to wear them. And so he wore them. And then I asked him, how did that go? And he said, I don't know what that is, but it was amazing. I always get a side ache every time I run up and down the court because of this issue that I have. And that never happened the entire game because I was wearing those patches.
Oh my goodness, that's huge. And I love it, especially when young kids can feel that and they notice
Mhm.
something, especially with the energy enhancer, because there are so many athletes that
Mhm.
wear the energy enhancer. Even Olympians wear the energy enhancer. Soccer players, swimmers, NFL, NBA. So the energy enhancer is huge when it comes to that. And I've heard lots of moms talk about kids, especially that play basketball, and they're just able to keep going. And the
Mhm.
coach doesn't ever have to take them out because they are never out of gas. I mean, they can just keep going. So just to have that encouragement for him with all this pain and the things that he's gone through for the last 18 months, to have that encouragement I just love that. Oh, it just makes me want to jump for joy. I love it so much. Okay, so a few questions. So let's see. I'm trying this. I don't understand, Vicky. You're gonna have to teach me how to use the chat right. Um, about your cataracts, Liana is asking, I don't know how to scroll properly. Um, you use 3. Okay, so Vicky did clarify, I think. You use 3 X39, 1 on each temple and 1 here. You were using 3 of the X39.
Correct. You had told me that's what you did, and it worked really well. I think I didn't do it the entire time, but I did it right before the surgery, during, and then after. And I felt like when I went into the doctor and he said, "Wow, you're healing so much faster than normal," it was a shock to see his face be so shocked because you could tell it just came right out of his mouth. He didn't expect to see that at my age.
Yes, that's awesome. So you didn't do the 3 of the Eon or 3 of the Carnosine at all?
No, I
Okay.
always wear every day. I always wear X39 on the back of my neck and the Eon right below the belly button, about an inch,
Okay.
inch and a half. So I never not did that. This was
Mhm.
just over and above. So instead of taking the one on my back, I did one, on each side and then one in the middle. And I never felt like that was giving me any reaction of any kind, just in case anybody wanted to know that.
Yeah, that's awesome. And were you wearing any carnosine at all? Because I know, just so everyone knows, carnosine is also a master antioxidant in our body, and it does have a huge benefit to eye health. So did you wear that one at all?
I didn't realize that until after the surgery. You had told me that. And so I started to wear it. And actually, interesting enough, because you have to lay a certain way with cataract surgery afterwards. It's very uncomfortable at times because you're not used to having to be so careful to not look down and to have your back at a certain level when you sleep. It's easy to be uncomfortable at times because it's just not natural. You can't just do whatever you would normally do. So I started getting sore in my right shoulder and just felt uncomfortable. So I put the carnosine on my right shoulder, and actually that pain went away immediately. So I have been wearing that ever since, off and on, whenever I feel the pain or something where I feel like it would help me. So, I mean, I don't wait for the pain to come, but I don't wear it every day. I would wear it like maybe 3 days out of the week.
Hmm. Yeah. Okay.
And it,
Awesome. Yeah. That's great. That's so great. And I love Diane is saying that is the best to watch someone have that pain relief, but especially your grandchild. So
I know.
I
It's
think
so
we are
cool.
all just absolutely cheering with you about that for sure. Pastor
Thank you.
Ed, what would you like to add?
I just wanted to thank you, Judy. What an incredible testimony for you and for your grandchild. I wanted to say a little something about pain, and I'll be really quick because I know that we're almost done. In the Western medicine, we all deal with pain in the sinews, and we deal with pain in the muscles, and also pain with the bones. And we're really good at fixing that. But what happens that in the East, they do a little bit different. They deal more with the meridian. And when an injury happens, a meridian splits. It's kind of like the highway gets broken, right? And that's what causes a lot of pain. Now, the doctor can put the bones together, can put the muscles together, and everything good, but still there's pain. So you say, why is the pain not going? It's because they haven't repaired the highway, which is to me more of the spiritual realm, where but it also has been found out that through cartilage, that meridian runs through our body, all over our body. So when a meridian is broken, the highway is broken and needs to be repaired. And thank God now we have the mechanism and the ability to repair that. And that's why your son is feeling the relief of pain. And thank God that we have it, you know. So I just want to thank you for that. And I just want to give a little explanation why people look at you like you have three heads and say, like, how did you know, David, through prayer and asking God to help him with this technology, now we have the ability to do that. So thank God, praise God.
Amen. Amen. I'm so thankful, so grateful to the Lord and to him and to all of you guys who continue to help us to be encouraged to do what we need to do, to not be intimidated to say something to people when you know that you're going to be able to help them, even if they don't believe it.
That's so awesome. Yes. Well, we are out of time for tonight, but please get back with the person who invited you to the call tonight. They will be happy to get you the information that you need. So, thank you all so much for taking time out of your night to join us. And we absolutely pray blessing over each and every one of you. So, God bless everyone. Good night.
Thank you. Good night.
Thank you, Judy. Good night. God bless.
Oh,